Answer therapy accesses healing responses that eliminate chronic musculoskeletal pain in 2 treatments on average. It's not pain management. That sounds nice, but how is answer therapy fundamentally different from every other pain relief method? How does it work? How do pain management methods work? Most of them are physical methods. They can numb your pain, manipulate bones, they can force tight muscles to release tension, etc. What do these methods have in common? 2 things. They all entail body manipulation, either biochemical or anatomical manipulation. And they target the symptoms of your problem, such as muscle spasm, skeletal misalignment, spinal degeneration, headaches, osteoarthritis. Those are all symptoms caused by something else, the root of the problem. Pain management is manipulation of symptoms. Most of them give you minor relaxation for temporary pain relief. That means they're not removing the root of the problem. For example, many people complain about chiropractic because they're in pain again soon after their appointment. They did not get enough relaxation to activate a deeper healing process. The chiropractor doesn't know what to do about it except to add massage to your treatment. They were doing it 30 years ago, and it's the same way now. If you still have chronic pain when you feel like you've tried everything, it means the root of the problem is still there. With answer therapy, there's no manipulation of symptoms, because there's no manipulation. All the biological work is performed internally by your nervous system. All the benefits result from actual healing. It's a totally different paradigm. Answer therapy allows your nervous system to relieve your symptoms and remove the root of the problem for pain elimination. For example, your nervous system can relax extreme muscle tension without manipulation. It can realign your skeleton without manipulation. It can stop headaches on the spot, including migraines, etc. Your nervous system has a whole set of responses to choose from. They're all spontaneous responses to comfort. So how do you start this nervous system healing process? I discovered a specific state of relaxation that I call absolute comfort. Think about the most relaxing treatment you've ever had. Absolute comfort is different. You won't find it in any other method. I can say that because you won't find the same healing responses in any other method. Like I said in part 1, your pain relief is built into your body, the autonomic nervous system's relaxation response. The stress response produces muscle spasms and pain. They're contrary forces, which means they don't mix. One displaces the other. So when you relax to the point of absolute comfort, your stress response is minimized. 2 things happen. The stress response in that area with pain cannot produce pain because it's not strong enough. And it cannot interfere with the healing functions of your nervous system. That's why your muscle tension goes back to normal, your muscles pull your bones back to place, your headache stops, etc. Those are natural healing functions. The end result is that local stress response relaxes permanently for permanent pain relief. These are all predictable responses because that's how the nervous system responds to absolute comfort. Every system in the body heals predictably when it receives the right support. In other words, there's nothing wrong with your nervous system. You simply need assistance to reach that critical level of comfort. I don't control your internal healing process. My job is to make my clients comfortable. That's all I do. Your nervous system takes over from there. So the medical theory is fairly simple. The trick is to achieve absolute comfort, both systemically and locally. That's not easy to do. It requires a new behavior science I talk about in Part 3. We're supposed to have absolute comfort every day, naturally. We're not supposed to have chronic pain that could heal at any time. But in modern society, we don't live in a natural state. Our daily stress level does not allow absolute comfort. So the purpose of answer therapy is to return your body to a natural state, where your nervous system can function the way it was made to function. Like I said, your nervous system can heal symptoms that manifest in the musculoskeletal system, such as muscle spasms and skeletal misalignment. It can also heal the sources of symptoms located in the nervous system itself. For example, as your muscle spasms relax predictably, your muscles pull your skeleton back to normal position. That's what happens normally when your body is not stuck. You can watch my client interviews where they talk about spontaneous realignment of the skeleton. You can actually feel your bones moving during an answer treatment. But why was your skeleton out of alignment in the first place? Something was causing your muscles to spasm and pull your bones out of alignment. There are several causes of chronic pain that are not known in mainstream medicine. I have a list of these causes on my website. For example, if your chronic pain started with an injury, you probably have a memory of physical trauma in the injury site, like a physical PTSD. That's a chronic pathology contained in the nervous system, in that spot. But it causes symptoms in your musculoskeletal system, bones and muscles. That injury memory can cause pain for decades after the injury heals. But decades later, your nervous system can erase injury memory with a mechanism I discovered in 1997. It's another automatic healing response. Mainstream medicine is unaware of injury memory and the mechanism that erases injury memory. For most people with injury-related chronic pain, the root of the problem is in the nervous system, not the musculoskeletal system. Most manipulation targets your musculoskeletal system. For that reason, they don't access critical healing responses. To summarize, there's no manipulation of any kind in answer therapy. Your body does its own manipulation automatically. That means actual healing. In one of my client interviews on video, the client says, "Who knew that relaxation would be the key to getting rid of chronic pain?" And she tried everything in 10 years of nightmare chronic pain. No one ever explained to her that relaxation is the only way to get rid of chronic pain. Every pain relief method must give you some degree of relaxation, even drugs and surgery. If a method gives you minimal relaxation, you get minimal pain relief. Look at failed back surgery syndrome. No relaxation, no pain relief. But then, when you achieve maximum comfort, you cross a threshold into nervous system self-regulation, where pain stops. Hundreds of pain relief methods try to do exactly that. Only one method guarantees it. Like I said, this is new medical science. No one else knows what I'm telling you. In Part 3, I describe what answer therapy looks like and my behavior science that makes answer therapy possible.